Summary: Sierra Leone has long struggled with some of the world's worst health outcomes, including a maternal mortality epidemic, in which a woman's lifetime risk of dying in pregnancy or childbirth is 1 in 20. Extreme poverty prevents most families from accessing healthcare. The Sierra Leone healthcare system is organized into two tiers of care: perinatal healthcare units (PHUs) with an extended community health program, and secondary care, which includes 21 districts and 3 referral hospitals. There are also 45 private clinics and 27 private hospitals, mostly in the Freetown area.
Actions and recommendations. 1. To have a greater share of health in national budget. 2. Easy access to healthcare program for all people in Sierra Leone. 3. Train more doctors, nurses, midwives, and other medical personnel. 4. Improve access to health care is the most important factor for improving quality healthcare and patients' outcome. 5. Connect with other healthcare organizations that wants to improve the quality of care. 6. Try to put citizens' health a priority.
That it takes you for listening.
My name is Jordan.
My name is Sean.
My name is Junha.
My name is Terry.
And today we're presenting you to our summary. Introduction. Myanmar has a population of 54.05 million people. The healthcare system of Myanmar is in horrible shape. Year after year, they continue to dwindle. In hospitals, many basic facilities and equipment are insufficient. Lack of doctors and nurses in Myanmar. Unlike other countries, the healthcare of Myanmar is poor. The majority of healthcare expenditures are still paid out of pocket by the patient. Myanmar's health system is routinely listed among the world's worst. Conclusion. Myanmar's government should concentrate on improving healthcare services for its citizens. There were only a few services available when researched in the Google: doctors, nurses, medtech, radtech, beds, and hospitals. Equipments are all things they need to invest in. Myanmar's healthcare budget still has to be expanded in order to provide adequate services to its citizens. Pilipino. Ang bansang Myanmar ay malaki. Pagkakaiba kumpara sa bansang Pilipinas, mas maganda ang mga programa ng Pilipinas kaysa sa Myanmar. Mas maraming proyektong pangkalusugan ang Pilipinas kaysa sa Myanmar. Mas mataas ang nakalaang pondo ng Pilipinas pagdating sa mga serbisyong pang-medical kumpara sa Myanmar. Ang bansang Myanmar ay kakaunti ang mga doktor at mga nurse kumpara sa Pilipinas. LA Chinese.
白花油可以治头痛、肚子痛和肌肉疼痛，可以用西瓜霜治嘴破、喉咙痛。
Action.
Investing in education. Educating populations is one of the most essential strategies to improve health in underdeveloped countries. People who are educated are better equipped to get safer occupations, to improve their health literacy, take preventive healthcare measures, avoid risky health habits, and demand higher quality healthcare.
Myanmar should give more funds in terms of healthcare system, create more hospital and beds, and give medical staff the right and deserved amount of salary.
Thank you everyone. 谢谢大家。
Hello everyone, I am Kyler.
I am Krista.
We also have Lawrence. We are Group 2. Welcome to the PYP Celebration. We are here to present to you our case study about the healthcare system of Canada. Canada's healthcare system. Canada has a universal healthcare system funded through taxes. Canadian Medicare is Canada's universal publicly funded healthcare system. It is not tied up to their job or their income. Rich and poor can enjoy equal access to healthcare. Like most free healthcare countries, a part of their taxes goes to the National Health Fund, and then the government pays for the medical cost.
Healthcare coverage of Canada. Surgeries, hospital fees, doctor visits. These health coverages are available for all Canadians with Medicare. Citizens can receive emergency and treatments without fear of bankruptcy. People sometimes say that Canadians have free healthcare, but Canadians pay for their healthcare through taxes. Healthcare is never free. Healthcare Fund. Canada spends $308 billion per year on healthcare services in 2021. Mindfulness art activity is a creative form of meditation. First, take a deep breath and relax. Raise your hand, then draw or write anything that comes into your mind.
Mandala art therapy. A mandala is an abstract design that is usually a circle. Mandalas can contain both geometric and organic forms. It helps us improve fine motor skills, creativity, drawing, and coloring skills. It's also a way to express our feelings and thoughts. Conclusion. Canada's healthcare system is among the best of the best. It has been recognized globally. It is funded through taxes. If you have public health insurance, you don't have to pay for most of the healthcare and emergency medical services. However, public health insurance in Canada does not cover every health services like prescription drugs, home care, and dental care. Overall, Canada's healthcare is excellent. It is a great example of medical care that other countries may follow. Suggestions. Overall, the Canada healthcare is excellent. The problem is that the wait time is too long. So as a group, we made these following suggestions. We suggest that Canada should hire more doctors so that the wait time could be shorter. We suggest that Canada should provide scholarship for students who want to study medicine so that more people can be doctors. Thank you everyone. 谢谢大家. As a dedicated healthcare worker, you have gone above and beyond to serve the suffering individuals and give them a new life. We all owe you big time. Thank you everyone.
From the land of Legos, from the great Christian accent, from the yummy Danish cookies and soft Danish pastries, we are Denmark. Now we shall present to you the health system of Denmark. Haya Edward. I'm Edward in Danish.
Haya khai thổ.
Haya Janelle.
Haya Steven.
Denmark's healthcare system is one of the best in the world because it is efficient. Everyone deserves the healthcare that they need, and the government of Denmark is providing it to all the citizens. They have a high quality of public healthcare services. It also uses the most advanced methods available. The people living in Denmark can receive financed health care, including primary care, hospital, mental health care, medicines, and long-term care services. Their health system progress are more efficient and more effective than the U.S. healthcare. It helps the elderly by moving into more efficient healthcare from them.
They have robust system in medical care. The robots can help them take medicine for them. They are using artificial intelligence, AI, for planning and optimization. It frees up time for calls at a hospital department. This ensures better hospital services and thereby benefits both patients and staff. They are trying to detect more diseases to make sure that everyone is safe. If you are working in Denmark, you are also entitled for a public health care card. Some of the pharmaceutical drugstores are here open for 24 hours. They have a lot of hospitals that support the elderly. One of these hospitals is called the Nursing Home of the Future. They also have preventive healthcare services for children. And until today, not only did Denmark help its own people, it also helps people all around the world to fight for human rights and poverty.
Now that you know about Denmark's healthcare service, you can now say that Denmark's healthcare is the best healthcare in the world. Mental treatment for people with depression, mania, schizophrenia, eating disorders, obsessive compulsive disorder, anxiety disorders, personality disorders, post-traumatic stress disorders.
Mental health services and programs in Denmark. Organic mental health problems. Crisis and catastrophe psychiatry. Geriatric psychiatry. Suicidality prophylaxis. Psychotherapy. Forensic psychiatry. Psychiatry rehabilitation. Mental retardation and psychiatric disorder. Psychosis and abuse.
Budget for mental health services. They spend 600 million Danish krone for psychiatry, around 4.7 Philippines pesos. Mental health nurses typically earns around 32,000 Danish krone per month, around Philippines pesos 224,000. They spend 11.1% for GDP for mental health expenditure, 5.4% of GDP for mental health. It spends 3,827 per person in public fund on healthcare. Denmark invested around 657 million euros for mental health and substance abuse facilities in 2019. These are the alternative medicines that the Philippines can also use. 正露丸缓解牙痛、呕吐、食物中毒、水中毒、拉肚子、肚子痛、消化不良、腹上、腹泻。
西瓜霜、牙痛、嘴破、牙龈脓肿、扁桃体炎、喉咙痛。
历练川贝枇杷膏，咳嗽、喉咙痛、声音沙哑、胸闷。
百花油、头晕、头疼、扭伤、瘙痒、鼻塞、腹胀。That will be all. Thank you, everyone. And remember, your happiness is a reflection of your health.
Clap along if you feel like a room without a roof. Clap along if you feel like happiness is the truth. Clap along if you know what happiness is to you. Clap along if you feel like that's what you want to do. Clap along if you feel like a room without a roof. Clap along if you feel like happiness is the truth. Clap along if you know what happiness is to you. Clap along if you feel like that's what you want to do. Bring me down, can't none bring me down. The love is too high, bring me down, can't none bring me down. I said,